Today, I would be talking about CSF Rhinorrhea or cerebrospinal fluid leak. Hi, myself Dr. Vivek Sasindran, consultant ENT head and neck surgeon. Well, you must be wondering what exactly cerebrospinal fluid is. So, cerebrospinal fluid is the fluid which is present around the brain matter inside the cranial cavity. So, this fluid provides nourishment to the brain tissue. It provides supplements and it has a lot of important functions, like it acts as a shock absorber as well. Now, sometimes patients may come to you with complaints of watery nasal discharge. Occasionally, they kind of pinpoint that this watery discharge is unilateral, that is from one nostril. And they tend to see it when they bend forward, when they strain. So when you have a history or when you have a patient who has these symptoms, it's very highly likely that you are dealing with a case of a cerebrospinal fluid leak or a CSF leak. So why would the CSF or the cerebrospinal fluid leak through your nose? Now, there is a bony barrier between the cranial cavity, that is where your brain rests, and between the nasal cavity. Now, if there are small openings or defects in this bony barrier, that is how this fluid will trickle down through the nasal cavity. So the same can also happen with the fluid trickling down into the ear when we call it as CSF Rhinorrhea. What are the simple ways to kind of differentiate if it is CSF or not? So one, as I had already mentioned, bending forward, straining, so you see few drops dribbling down. Two, the patients usually will tell that this has a salty taste. So the CSF fluid generally tends to have a salty taste. A simple bedside test that you can do is you could kind of collect this fluid on a kerchief and let that kerchief dry. So when it dries, in normal situations, if it is mucus, if it is nasal discharge or nasal secretions, it tends to stiffen the handkerchief. Whereas if it is a CSF fluid, once it dries up, you will not find any kind of stiffening of the handkerchief. So this is something, a simple way of kind of differentiating. Apart from this, you have other tests where you can collect the fluid, send it for analysis, but many times the drawback here is that the patient will not be having active leak all the time. So it may be seen occasionally, so by the time patient goes to collect the tube to collect the fluid is already gone. The next thing that can be done is a simple nasal endoscopy. So you could just consult your ENT surgeon who would introduce a endoscope and kind of visualize the nose and see if he can see any kind of active leak from any of the sites in the nasal cavity. And then we usually resort to radiological testing, which is basically CT, MRI. Now there are different tests that are recommended for evaluation of a patient with CSF leak. So it's not just one test that we routinely do for all the patients. So you should understand that there are different reasons why a patient can come to you with CSF leak. One clinical scenario is a spontaneous leak. So this is the most common scenario, that is spontaneous leak, where without any cause patient notices watery fluid dribbling from the nose. And this is commonly seen in females over 40 years of age and who are slightly on the obese side. The second scenario is post-traumatic leak. Now, post-traumatic CSF leak is something that is very common. So following an accident, you can have multiple fractures along the base of the skull, and through these fractures, CSF can dribble down. The third scenario is when the pressure within the intracranial compartment is kind of very high. In order to release this pressure or relieve this pressure, there may be small defects that develop along the skull base through which the fluid kind of dribbles out. And it can also be a manifestation of an underlying brain tumor. So definitely if you have a unilateral watery nasal discharge, that warrants investigation and further evaluation. So when you talk about radiological evaluation, as I already mentioned, there are different types of images or different types of tests that we can choose from. So depending on the scenario, your doctor would actually select the appropriate test for you. So in most of the scenarios, we require a combination of a CT scan with a MRI. Now occasionally, we also resort to a special test called as CT cysternography. Now once a diagnosis of CSF leak is confirmed, we basically look at few things. One is where exactly is the defect, which is the site through which the CSF is trickling down into the nasal cavity. What exactly is the size of the defect? Now, is there any other associated features? Is it a high pressure leak? Is the intracranial pressure really high? Now, these are things that would go through our mind before we take up a patient for surgical correction. So, the treatment of CSF rhinorrhea is generally surgical, except for traumatic leaks. Now, usually following trauma, you would find a CSF leak, but most of the cases this will settle down within around 10 days with conservative line of management. Now, other entities, be it spontaneous leaks or persistent leaks post-trauma, that is after your conservative line of management, all these leaks have to be attended to or have to be addressed. They have to be repaired. Now, what happens is if a CSF leak is not repaired? So what happens is that there is a persistent communication with the cranial cavity. So that becomes a route for infection to travel into the cranial cavity, and that would probably be a cause for meningitis. So you also have a subset of patients who would have ignored their watery nasal discharge for months, years, and probably you would find them landing up with meningitis one fine morning. So the patients will develop headache, vomiting, fever, and eventually can even go into a comatose stage. So that is how unattended CSF or untreated CSF could land up with complications like meningitis. Now, when it comes to surgical closure, we generally have two options. So one is basically the endoscopic option, so which is currently the method of choice. This is minimally invasive. The entire repair can be accomplished through the nasal cavity. So you could introduce a small endoscope into the nasal cavity and kind of delineate the entire defect and plug it, repair it, and seal it off. And the traditional method, which was the transcranial approach. So transcranial, where you would open it from above, retract the brain, and subsequently repair the defect from above. Now, it had issues with the brain retraction and the longer duration of stay in the hospital and so on. And that is why if you see now, more than 95% to 97% of the cases can be successfully repaired by a endoscopic approach. So this is the current treatment of choice. Now, there are very few indications for resorting to a open approach, and these surgeries are usually carried out by a team of skull-based surgeons that includes ENT surgeon, neurosurgeon, and usually these sites are repaired with fat which is harvested from the thigh, again fascia, which is a sheet-like material which is obtained from the thigh, or even with locally available flaps, that is within the nasal cavity we have some flaps. So these are flaps which are again used for reconstruction. So it's usually a multi-lead reconstruction that we resort to, and the success rates are over 95%. Thank you.